opposite of our range of motion test. So with our range of motion, you have the patient look which direction? Away. So with manual muscle testing, they're looking to the same side. Okay, so they're actually looking, we allow them to use the muscles, we want them to use the muscles. So hand at your side, please. You're just gonna have them in a palm up position, okay? They're gonna go through the same extension motion that they did with range of motion. So as far as your clinical organization, think about this. If I'm measuring manual muscle test and range of motion of extension, I can do them both from the same position, which is very, very helpful. Okay, so what we don't want to see with manual muscle testing of this extension motion, what might you see compensation-wise? Yeah, someone's trying to reach up and back, they're going to want to rotate and lift the whole front of the body and twist. You may see them really trying to almost laterally flex to the same side. You might see them even raising their head up off of the table. So as she comes into an extended position, you're most often going to see the full rotation. Okay. So we want to go to the end of her range of motion. Again, when we talked this morning about normal range of motion, 50 to 60 degrees is a lot. So if someone can't get to 50 or 60 degrees, I'm not going to say they're not at a 3. Okay. So let's have you lift your arms straight up for me. It's pretty good motion right there. Okay, so I would say she's got normal range of motion. One of the other things you're going to see is the hand coming out to the side. So I'm going to cue her, keep your hand right next to your side as you lift up. Okay, so I'm going to take her through this range of motion here. I can see she's got the motion. Actively lift for me again. Nice, she's got the motion. Okay, so on this next go round, I'm going to give you pressure. Okay, so lift up for me, hold it, don't let me push it down, don't let me push it down, don't let me push it down, and relax. Okay, go ahead and relax your arm. So you can rotate. Oftentimes I will like to look at the patient's face, so I may stabilize at the shoulder or just feel what's going on with the shoulder and press, because which muscle, main muscle are we looking at, or muscles for extension? Posterior delt, lat. So if I'm palpating posterior delt, if I'm trying to check for muscle contraction, I'm going to be right here. Kind of hard for me to do if I'm right here. So I like to pivot my feet. So lift up for me. Keep your hand in towards your side. Hold it there. Don't let me push it down. Don't let me push it down. Don't let me push it down. Hold it. Good. And relax. So I like to have my hand right there on the shoulder. That's my preferred. In the video, they're showing this. But sometimes I think they just get out of the way so you can see in the video instead of them blocking the camera. So I prefer this position right here. Okay. Let's have you go ahead and sit back up. So same position, again, for all 5 grades. Can they get full range of motion, hold maximum resistance? Do they break with moderate? Can they get through the range of motion but they can't take any resistance? Then I'm just palpating for twitch. See if there's any movement. Okay. Excuse me. So with these, motions, did you notice where my resistance force was located? Exactly, it's proximal to the elbow, so we're using a short lever arm. If you come back into a 90-degree flexion position right here. If I'm pushing on someone's arm out here, I'm going to win. I'm not going to have any 5-out-of-5s unless somebody is really, really strong. Okay, I'm not going to have any 5-out-of-5s, so we give the patient benefit. These aren't very big muscles back here, so we're going to go proximal to the elbow. So it's the distal humerus as your force